Well, we are back with our sponsor from Arkansas Surgical Hospital, and happy to have Dr. Dana Abraham here with Abraham Breast Clinic and Arkansas Surgical Hospital to talk more about some of those breast cancer questions we have. It is the month to be sure everybody knows the latest and knows what we can do to stay healthy. Good to have you.
Thank you so much for having me.
So much talk about finding a cure for breast cancer,
Yes,
but there
yes.
is still not one, right?
Unfortunately, no,
Yeah.
For metastatic breast cancer.
For metastatic,
so-
which is one that can be so aggressive.
Right. Well, that's the one that has spread to other parts of the body, and
Right.
so it's really hard to cure it once that's happened.
Let's talk about what we can do. We talk about women, but men too. Is there anything we can do to prevent or give ourselves better chances?
Yeah. Well, it's really all about risk reduction, because there are risk factors you can control and risk factors you can't control. And so things like exercise and not drinking excessive alcohol, obviously a healthy diet, getting your weight down to maybe a normal BMI. Those are all things that will help lower a woman's risk.
The stats just show the healthier you are, at
That's
least
right.
it lowers your risk a little bit. Of course, there are genes that I know a lot of researchers are looking at, and you can look into that, but most of us just need to be healthier, right?
Right, exactly.
Yeah. Let's talk about some other things like breast exams, self-breast exams and things like that you can do.
Right. It's really important to get to know what your breasts feel like, because they're all lumpy, and you're just looking for something that catches your attention and it doesn't feel right. And anytime you have any questions, it's best to tell your doctor and be sure that they evaluate with an ultrasound,
Right.
At least, depending on your age.
Know your body is what I hear a
Exactly.
lot of doctors say,
That's
so that you
right.
know if something has changed, you know
Exactly.
what yours feel like, and you know when it's changed.
Exactly.
Talk about mammograms and how important those are.
Mammograms are a way to catch cancers when they're too small to feel, and so there's a lower stage. Sometimes we catch cancers that are not yet the kind that could get loose in the body. So we try to individualize the recommendations for mammograms on your family history, other risk factors. But at 40, I like for people to get a baseline just so we can kind of see how the tissue's arranged.
Right.
And then certainly at 50 to start getting them annually.
Yeah, what do you tell to young women who've never had one before? They're scared. They say, "Oh, I've heard that it's really uncomfortable."
Yeah, it's not going to hurt. It's not going to hurt that long.
Yeah.
It's the benefit is very much worth the uncomfort.
Right. When I talk to young women who are going for their first one, I'll say, when you're done, you're going to say, "That was it."
I know,
that I
yeah,
worried so much. The hardest
exactly.
part to me is hold your breath while they're taking the image, really.
Exactly.
And that's over very quickly, too. Let's talk about surgery, because that's where you come in at Arkansas Surgical Hospital, and that's a wonderful place to work.
It's very nice. They take care of the patients and the families, and they're just very dedicated to making sure that women are comfortable and cared for. They take excellent care of my patients, and since the rooms are like hotel suites, they actually have a space for a family member or some church members or whatever, and then the patient has their own private space.
Yeah, I think we've talked so much about the orthotics and the other surgeries that are done there, and maybe didn't realize the breast cancer surgeries are
Right.
performed there as
Right.
well. This month is just really important every year, because I think we get new women listening about breast cancer awareness. Do you think it's getting better and better?
I think most people are aware of breast cancer, but it's kind of difficult to find out. I think some people think that if they don't have it in their family, that they're not at risk, or that you're too old to get breast cancer. But unfortunately, breast cancer is a disease of older ladies.
Sure, yeah.
So the older you get, the higher your risk,
The more
unfortunately.
important.
Yeah, and family history is only a part of about 10 to 15% of breast cancer diagnoses. So you're not protected if you don't have any
Right.
family history.
In fact, the majority do not have family history
Exactly,
who end up
exactly.
having breast cancer.
Exactly.
Okay, we need to put up the information, of course, about Arkansas Surgical Hospital, and also you're going to be on Facebook Live
Yes,
in
yes.
a couple of weeks or a week or so to talk about questions and answers too. How's that
Yes,
going to work?
that should be interesting. We will start with some questions just that we think that a lot of people would be interested in, and then of course we'll take questions from the Facebook Live broadcast itself. So it should be fun.
Yeah, so if you want to ask questions right there on Facebook Live, I think you'll probably just type them in and someone will give them to you.
Right. And
there.
I'll just tell you what I know.
Yeah, so that's coming up October 26th at noontime. And, if you think your grandma or your mom needs to be a part of this, go help her get on Facebook.
Exactly.
Sit there with her, and it would be a wonderful conversation to have. Dr. Abraham, thank you so much.
Thank you for
coming.
having me.
We appreciate you. And, of course, Race for the Cure coming up on November 3rd. We're all
Yes.
very excited about that. about that. Okay, we will be back with a check of your forecast for this weekend in just a moment.